Welcome to today's webinar. We're delighted to be joined today with David Casey of Decare Dental. Today, David's going to take us through future and health and well-being in the workplace. And David is the Wellness and Health Promotion Manager with Decare Dental. We're delighted that Decare Dental have partnered with us as part of our Grow, Scale, Succeed campaign. And I know, David, you've shared some great resources, some blog articles already. As part of National Wellbeing Day, we're launching the wellness section of the Grow, Scale, Succeed website, and this webinar is part of that too. So we're delighted that you could come along today and partner with us to help educate our members around wellness, because I know that's something that Decare Dental specialise in. So yeah, over to you, David.
Thanks so much, Helen, and thanks for having me. And happy Workplace Wellbeing Day to everybody that's tuned in. I suppose the first thing to look at there are our workplaces looking like this, where we have nice, healthy salads, greens, 3/4 of the plates full of fruit, vegetables, water, we're all smiling? Or do our workplaces look a little bit more like this, where we have the donut, we don't have time for lunch, and we're a little bit rushing and we're not kind of planning and having that work-life balance? I suppose for the companies out there today and for small businesses in Ireland, I would like to know kind of what stage of the wellness journey you are at. So whether that might be you have a wellness strategy or policy in place, or whether you're just kind of finding your feet with wellbeing. So I hope out of the presentation today, you'll be able to take some valuable information and insight to relate back to your own business and company. I suppose the image you see there is what we call the life course image and the life course approach. And you can see from about the age of 15, where it's highlighted in yellow, when we start our kind of first part-time jobs, right up to the age of 65 plus. And 65 is by no means the retirement age, but that's a huge lifespan that we spend in the workplace. And workplaces directly affect our physical, our mental, our economic, and our social well-being. And in turn, that affects our families, our community, and our society. So the workplace is really an optimum place to promote health and well-being, and the WHO and the World Health Organization Centre actually address that and have actually put out guidelines that it is the optimum place to actually prevent chronic disease like cancers, diabetes, obesity, and also to support mental health. I suppose just to look, being a small business, why would you, what are we doing with wellbeing, and what kind of initiatives and interventions are we picking, and why? I suppose we're all busy in our day-to-day lives, and sometimes we can look at social media or the paper, the Irish Times, whatever it may be, but it's good to kind of come back to what's causing mortality in Ireland today. And I suppose what we're seeing from the CSO 2016 is that cardiovascular disease, so heart disease and stroke, is the #1 killer presently in Ireland today. Cancer falls in at #2, and respiratory disease falls in as the 3rd common cause of mortality. So interventions for small businesses, heart disease, stroke, blood pressure interventions, reducing stress, screenings on site, cancer awareness are 2 huge areas that we can focus on. I suppose what I'd like to say to people is what non-communicable diseases. Years ago, there was diseases like TB and cholera, things that people could catch, and those were the things that were causing mortality and kind of killing people. And in Ireland, we've had a shift, fast forward on to 2019, and what we're seeing is it's diseases called adult chronic disease or non-communicable diseases. And these are the things that are causing the highest mortality rate, both in Ireland and globally today. And these are things like cancer, cardiovascular disease, like I'd mentioned, lung disease, diabetes type 2 is going to increase and double by 2030 in Ireland, and obesity, it's not a disease, but it's a disorder that causes and links to a lot of the above. And it might shock some people that these are 60% of deaths globally, and within Ireland, the actual statistic is actually about 87% is disease that causes mortality is cancer, stroke, diabetes, and lung disease. And for small business out there today to focus on wellness initiatives, it is quite daunting, and the industry is flooded with so many articles and links, and it's very, to get a good wellness strategy and a good plan in place, we should be focusing on what we call modifiable risk factors. So there's 4 modifiable risk factors that are WHO, kind of World Health Organization approved to reduce these non-communicable diseases. And these are initiatives that focus on diet, in physical activity, smoking, and alcohol. So if you're a workplace out there, these are 4 key areas that you can optimally invest in and invest time, invest budget. Diet and physical activity, smoking, and alcohol. These are key areas that you will have return on investment. So I always ask people, and I'd always encourage companies to ask people, what is health? Because health means different things to different people. And knowing your company culture is really, really important. Every company is different. Every small business is different. Whether you have 5 employees or whether you have 25 employees, it's really important to ask people what health is and what health means for them. And if you're doing a Survey Monkey, a Google form, a questionnaire with your staff, it's really important to include that question, because health, depending on the stage of the life course they're at, means different things to different people. And this question will actually give you, inform you about your company culture, and will kind of give you a real insight to what your employees and what your kind of society and company culture, what health means to them. So to look at health, I always would say to people, back in 1946, the WHO has actually, they were ahead of their time and said that it was a complete state of physical, mental and social well-being, and not merely the absence of disease. So to look at health for a company, that definition, it has been praised and criticised. So there is no complete state of health. So for example, there with physical health, mental health, if someone suffers from ill mental health, if someone's in a wheelchair, if someone suffers from diabetes type 2 and has a controlled blood sugar, that's not technically not a complete state of physical or mental health, but there is no complete state of health. So the WHO, and it's very important to recognize that for your workplace, we're moving more towards a definition that health is a resource for everyday life. It's not the objective for living. It's a positive concept emphasizing our social personal resources as well as our physical capabilities. So we're kind of coming away from that idea that health is just disease and it's bacteria and it's picking up, it makes us sick. Health is more of a positive concept. And this is the kind of mentality we want to be in when we're trying to kind of create a supportive environment for our workplace. To look at this and the biomedical model of health, it's just a name on it, but it's technically the way our health system is looked at in Ireland at the minute. So if we could ask one thing that you take away in workplace wellbeing day to day, it's that you take away the concept that health is not just disease, it's more than disease, it's a positive concept that should involve the promotion of health before we get to that in health stage. And what you see in the diagram there is you see the standard sick person, they go to GP, they get a prescription, they go to hospital, they have an operation, whatever it may be, and they come out cured. And often that's the biomedical model. It's very focused on disease itself and not so much the promotion. And I'd ask the controversial question today, do we have health services in Ireland or do we have sickness services? And the reason I ask that is because a lot of our budget actually goes into, over 70–80% of our budget goes into the treatment of disease rather than the treatment of actually the positive promotion of health. And this is where the workplace can really get involved, because what we're moving towards is a concept that is actually very holistic. And this diagram here has been included, it's in our Healthy Ireland strategy, it's in a lot of different countries' health systems, and it's governed, it's called the Dahlgren and Whitehead model. They were the researchers that developed this, and what it emphasizes is that health is more than sickness. Our social, psychological and biological environments are all kind of at play together. And if you look into the red circle in that, there's a genetic, this looks at our age or gender and other factors. So what's going on with ourselves. So if you imagine that's yourself or that's your workplace, what's the age demographic, what's the gender demographic, male, female, people have genetic components, things that we can't control, and that's all contained within that red circle. On the outer kind of purple circle is lifestyle factors. So these are things like the alcohol, the smoking, the physical activity. That's kind of classed as these things really impact on our health. A huge one is our social and community networks. That's the blue circle that you're looking at there. And social and community networks, we now know, and we have the science and the evidence base, that we need friends, we need a good family, we need a good support network around us, because it dramatically impacts on our mental health, our physical health, and our social well-being. And then you'll see, being Workplace Wellbeing Day, and for all the small businesses out there, the very, very top one, living and working conditions is a key determinant to our health. It causes stress, it causes mental ill health, it can cause physical ill health, sedentary lifestyles, sitting too long. We're hearing a lot about Cheers Can Kill campaign from Irish Heart, where we need to make our environments a supportive environment to promote health, because we're in the workplace for such a long time in our lives. You'll see other determinants there, like our level of education, where we're living, our access to healthcare services, if we're employed, if we have a job, we don't have a job. And then the very outer circle, things you mightn't think that would affect your health, but are things we don't have control over. So things like environmental policy, things like government policy, things that are like the transportation policy, things like you might even think that greenways and different things that are set up, they're all actually there. They all have a health benefit to improve our health. So it's just looking at health in a very holistic way. And for a company, it's very important to encompass health like this, because tying in things like our sports and social, our corporate social responsibility, all of these things have a health benefit. And often companies have they're doing so many things in so many different places, but often it's just partnering and actually linking up all these different committees and all these different things to have a very, very good connected health policy and health vision. To solely just look at mental health for a second, because it is such, 1 in 4 suffer from a mental ill health condition in Ireland, and this is what we call the dual continuum of mental health. And again, it is the science behind it, but what I'd just simply like you to take away from today, mental health, if you imagine yourself in a bubble, and the bubble is around you, and life throws lots of different things at you. So when you get to the age of 30, or maybe the marriage, the mortgage, a parent passes away, or whatever it may be, it's having this resilience, it's having the education, to mindfulness, to be able to cope with everything that kind of life throws at you. So often with employment and with the workplace, we're a bit fearful, and there is a huge stigma that's associated with mental health. So what this actual diagram, it's in a lot of workplace wellbeing strategies, and what it does is I want you to look at the right-hand side, and the right-hand side is optimum mental health without mental illness, and the lower right-hand side is poor mental health without mental illness. What that means is that we look at mental health on kind of two hands. We have a diagnosable mental health condition, and we have mental health. And the umbrella term to that is everybody has mental health. So whether we have a condition that's diagnosed and we're taking therapy or pharmaceutical therapy, whatever it may be, that's a mental health diagnosed condition, just like a physical health diagnosed condition. But the umbrella term over that is mental health, and everybody has mental health. And what I'd like to say to workplaces out there, it's important we understand that even if someone does suffer from a mental ill health condition, that the umbrella term is mental health. So there is certain strategies, there's certain interventions, creating a supportive environment, having a policy that's in place. We can support everybody's mental health in the workplace, regardless if they suffer from a mental health illness or not. And that's really important, because a lot of people don't understand that, a lot of workplaces don't understand that, and it's really important to have that information out there to know that we should be promoting everybody has mental health, and there is no health without mental health. So that diagram there, what it shows is just we have mental illness and we have mental health, and that's just a way of putting it into your strategy. They also, from the science of it, I would just like to say, if you ever look up an intervention or use Google or whatever you're looking at, maybe there's lots of different mental health interventions. One of the best things I've heard was at the Talent Summit, they had it called a Blind Date Friday. And it was all about engagement, and they were getting rid of all the hierarchy in the companies, and they put in everybody's name into a hat. So whether you're a management, a team leader, or whether you're an entry-level employee, they drew out a name every Friday, and what it was that person went and they had lunch with a person they hadn't been with in the organization or the business. And again, what it does is it's all about engagement, it's all about the human connection, it's all about kind of connecting back with people. And again, there's a lot of simple initiatives that promote a positive culture, engagement, that actually do impact on mental health. One of the I suppose the main evidence base where this comes from for workplace is this review that was done on the psychosocial work factors, and what mental health kind of presented itself in was when they found in 2003, it's one of the biggest scientific studies, was long hours, work overload, lack of control in your role, lack of participation, and an unclear management and work role led to mental ill health, and it presented itself in the following ways. So again, for any employers out there today, I will be looking at things like absenteeism. We often don't get the cert that says mental ill health. There's a huge stigma around it. It can say sickness, it can say just absent. We need to be have a policy and create a supportive environment so we can tackle some of these issues in the workplace. Productivity, increase in error rates in people's work, loss of motivation. So this thing of presenteeism, are we present? We can be there 9 to 5 in our jobs and be on Facebook and doing different things and walking away from our desk and not be actual present to our jobs. So we know happy, healthier workers are more more motivated, they're giving more into our roles when we look after mental health. It also showed up in things like poor timekeeping, staff turnover, conflict between workers. So again, that kind of circle on the right, I would be looking at that as an employer, and I would be kind of seeing, okay, am I seeing this in my organisation, and asking myself, what could I do to support good mental health with my employees, regardless of what size of the company. And I suppose this is, regardless of your religious background, this is the Bible in health promotion for the workplace. If you've never seen this document, it's in 15 different languages, but it's available free as a resource, and it's so easy to read and understand. So if you're a company that's just looking, particularly a small business that's just looking at wellbeing for the first time, I think you can take an awful lot out of this actual publication. It's available online on the WHO website, and what it looks at, you can see the blue circle there, the physical work environment. And what the physical work environment was traditionally where health and wellbeing started, with health and safety acts and the type of work we're doing and accidents in the workplace. And basically they started with making people not die in the workplace, was the keeping people alive, and really kind of more to health and safety. And that was our physical work environment. We've expanded on to that coming into 2019, and we now have our psychosocial environment. So our attitudes, our values, our beliefs, and a lot more than that's in there. We have our personal health resources. So things like, what are we offering on sites, as in like to do with alcohol, diet, nutrition, and then we have our kind of community involvement. So being a workplace in a small business or a medium-sized business, we can go with community involvement. That's our corporate social responsibility. We can do fun runs, lunchtime miles, help to community. We're kind of taking health not just for our employers, but actually to our spouses, our partners, our families, into the community, and we're kind of actually benefiting society. So it kind of gives you, it's a really nice documentation, and it gives you a good map of what you can actually do. Particularly, it gives some examples and sample policies in there that you can amend and fit into your own workplace strategies. CIPD, and there's a huge amount of evidence and research, particularly that was released last year in 2018, all about what the occupation and the role of the manager. And I think we've all heard that people leave managers, not roles, and we're really kind of investing in this. And this is becoming more and more in research, that the occupation and the sector that we work in, so whatever the job role it is, whatever the sector, whether it's tech, science, pharma, whatever it may be, but also the organization's culture. So culture is huge. So that the culture is people working in that, the environment they're working in, and what's created with the attitudes, the values, the beliefs of the people that are working there. The management style is huge. So our managers trained in health and wellbeing, in best mental health practices, in managing people. And often we'd see some of the biggest evidence comes with engineers, that they go into a company, they've several degrees, and they often work into a project management role where they're managing maybe 8 people or whatever it may be, but often you don't have management training, and that's a key to invest in your staff, because, and particularly speaking of the health aspect, it's crucial. And these equal our health outcomes. So again, it's moving away from this definition that we're thinking that health is caused by bacteria and viruses, this biomedical kind of environment, that it's not. It's actually a lot of things impact on our health, including the type of work that we do, the culture, the management style that's in place within an organisation, all add up and equal into our health outcomes. Again, I really like this image. It's that we have the skyscraper that looks really nice, and we have the skyscraper that we've just kind of lobbed on a little bit. And being National Workplace Wellbeing Day, I would say to organisations, please be the skyscraper on the left, that it's a top-down approach. So if you're a manager watching today, or a team leader or an employee, feed it back into it has to be from the top down. It has to be embedded from the top, that it's recognised the whole way down. It's no good adding on wellness like the image on the right if we don't understand that staff they're not let out to these events, or it's no good having a brilliant health screening on site and blood pressure screening and mindfulness and yoga when the staff can't get time to even attend the sessions. And that does happen. So it's really important that we have this top-down approach, that everybody's in on it. Managers are trained, team leaders are trained, that if there is a hierarchy or organization, kind of a chart in your organization, that is addressed. And it's, again, top-down approach is what works, and all the evidence is showing that. This is a funny picture for Workplace Wellbeing Day. It's what we see there is a man drowning, and this is where we want to go for the future of workplace wellbeing. And what we see is when we see someone drowning, we tend to we'll run, we'll call 999, we'll call an ambulance, and next thing we see another person drowning, and we'll run and we'll call 999, call an ambulance. What the analogy is there is we need to look at what's happening upstream. We can't spend all our resources when someone's sick and when someone is absent in work. So someone's handing a sick cert, someone we're seeing absenteeism rates in small business, we're seeing all these different things. We need to go, hang on, let's move upstream and go, what's causing these people to fall in? And that's what a top-down and upstream initiative needs to be in small business, where we have policy, where we have a policy in place, a procedure in place, managers, team leaders, employees, the whole organization is supported in proper health and well-being. So that's the message to take away from there, that it's top-down approaches, policy level, and that there's training particularly involved. I have a scenario here, and I just wanted to show you a different kind of scenarios. If you see in the blue there, this is a hypothetical situation, but Richard's 60, he's an engineer, he lives in Dublin, and he has a track record of excellent work. He's a widow, and he's showing early signs of dementia. And if we look in the centre there in the orange, we see that Richard, he has to take more than a week off at a time. He tracks his own health. He's currently self-managing his dementia, which he's been diagnosed with, and he's fearful of the stigma there around to tell his colleagues. He feels isolated, and he's in need of advice, and he doesn't know where he can turn to, and he can't afford to retire yet. He's on a full-time 6-month rolling contract, and he feels easily disposable in his role, and he feels anxious about his future. And if you look to the very purple one, the very last one here, we've got kind of a third scenario, which would be the company I would say we'd all like to work for. Richard works remotely and on site, so there's flexible working there, which is huge. Richard has health, dental and pension benefits, so just a role of benefits and financial well-being and planning if an organisation can offer that. His employers are aware of his dementia as it was flagged in a company screening. So we're seeing that the employer here is really taking an initiative to embed some sort of health and well-being structure there where this was flagged. He feels supported and has the option to work less and spends more time with his grandchildren. So again, we're seeing that kind of socio-ecological, that very layered, holistic approach to health, that the employer appreciates his staff. There's a good company culture there. There was health screening. There was a health and well-being. There was something set up there in that organisation to kind of support him in this situation. And again, this is hypothetical, but again, there is an extreme where you would see each one of these in different companies, the blue, the orange, and the kind of purple. And again, I think we'd all like to be working for the company that has the last outcome. Another thing to include in health and wellbeing is dementia. Again, we have mental health and dementia. It is on the increase in Ireland. It's silent. We train in the healthcare sector within DCare. We train nurses, carers and doctors in a healthcare programme and on dementia in the healthcare sector. And again, we're seeing it's a huge, it's kind of the silent kind of thing that we're not hearing too much about. And there is lots of different workshops as well we can offer for health and wellbeing, which regards dementia prevention as well. So moving just towards the future of health and wellbeing, what are we seeing? So we're seeing Sir Michael Marmot in the UK is like the guru that wrote the Bible on determinants of health for the World Health Organization. He's also just actually released a mental health determinants kind of whole documentation that himself and his team has done. But what we're seeing is we now know this kind of, we need to promote health in the workplace. We need this kind of from womb to tomb approach. We see that he's done a huge amount of evidence-based research that the first 5 years of life are crucial for mental, physical, social, everything is laid down on those first 5 years of life. And what we're seeing is we're seeing a lot of lunch and learns, we're seeing a lot of kind of growth in the health and wellbeing industry on things that are on kind of prenatal, postnatal, the first 5 years of life. That's a huge growing area for health and wellbeing. You'll see again in the coloured section right across the lifespan the need for intervention and the need for constant health and wellbeing programs that we need to be checking and monitoring our health. Mental health is particularly huge. 1 in 4 suffering from mental health, and again, this is an area I feel particularly with stigma in mental health, we really need to kind of improve on. And I'm delighted to be speaking with Helen, has asked us to speak at the SFA annual conference in May, which is Mental Health Awareness Month with the green ribbon. It's all about reducing stigma. And again, as we enter the silver circle and kind of going into the age of kind of 60s, 70s, 80s, again, constant intervention is needed to promote optimum health. So again, it's kind of the key message to take away from there is it's not a one box fits all, it's not a one size fits all. With health, it's constant and it has to be done across the lifespan and across the workplace. Very last, I'd like to sum up, and I'd just like to tell you a little bit about, we write for SFA magazine, and there's some health and wellbeing articles in there in every quarterly edition. We do a lot of different things within DCare, including our health and wellbeing training, and we do a health and wellbeing training in mental health and mental health stigma for managers and team leaders. We do a range of wellness programs as well as our dental benefits. So as well as doing dental benefits for up to 500 organisations, we do wellness and training. So we do things like oral health checks, lunch and learns, diet nutrition programs, parenting seminars, smoking cessation programs, blood pressure checks and health screenings on site. So we have a range of options that you can avail of and you can choose of. And if you have any questions on anything, please get in touch. We'll be happy to work with you and your company on developing a health and wellbeing policy as well. And lastly, I'd like to end with the wealth of business depends on the health of workers. And again, I think this has never been never more true that if you invest in your staff, invest in your employees, you will see that return, because happy, healthier employees equal a more productive, happier, more engaged workforce. And yeah, my email is there, dkc@decaredental.eu. If anyone has any queries, questions, anything about the webinar that we've done today, please forward them on. And I'd like to thank Helen and the SFA for having me here today as well to educate you on Workplace Wellbeing Day about health.
David, brilliant presentation. Thank you so much. I learned a huge amount there. I particularly liked the 3 case studies there with Richard, you know, because there are lots of different working environments out there that look like that. You know, and I'd say with the third one and the purple one, I'd say Richard would probably stay more longer with the company. He'd be less likely to go ill, you know, be present. So, I mean, there were really good examples there. I really enjoyed those. So, you know, for our members, if you really want some assistance with a workshop on wellbeing or a policy or something, do get in touch with David and Decare Dental. They're great. They'll help you and support you. And we're super excited that you're coming to talk at our conference on the 2nd of May.
Thank you so much.
So, and that's actually, you're talking about mental health stigma, and I know that in May it's the Green Ribbon Month.
Yes.
So it's all looking, so it's tying in really nicely there.
Tying in really nicely with your conference, And again, that 1 in 4 do suffer from a mental health condition in Ireland, and we do focus sometimes a little bit on the diseases, so it's really nice to really highlight the stigma that's around it. There's a lot of mental health interventions out there, but really it's breaking down the stigma in the workplace, that people feel comfortable and feel they have a supportive environment, that they can talk about these issues and people recognize them as well.
No, it's crucial, and you know, and it will help with the whole holistic approach, rather being more proactive rather than reactive. So listen, thank you so much for coming in today. We hope that you got a lot from this webinar today, and do check out our resources on sfa.ie. And thanks again, David.
Thanks so much for having me. Thanks, Alan.